three.
Hi there, my name is Dr. Mullet. We've got a patient on our hands that's got a little tickle in his atria. It's called atrial fibrillation. Now, we want to take care of that tickle. And with that, we're starting him on some medicine. Because you know, to tickle, it's a sin. That's right, we're starting him on Tikosyn. So, I'm going to take you over here. We're filling out this order set for Mr. Buttercrunch. And now I'm going to get this in and go talk to that RN. Well, hey there, Colleen. I just saw Mr. Buttercrunch there in 213, and we are going to start some Tikosyn on him. He's got that atrial fibrillation, and we're going to start him on that medicine. Now, I want you to know that I want you to call me with those EKGs, and we'll discuss the QT and R to R measurements on the phone. Tell that nighttime nurse that you'll call me tomorrow. You're going to be here tomorrow,
I'll be here tomorrow
right?
morning,
Okay.
yes.
Then you'll call me tomorrow with that 2300 EKG.
All right, looks like I got an order for Tikosyn. I've already got the 12-lead EKG completed. It's been scanned into Epic. My next move is to call the physician and have him read the EKG. Now let's see, what information do I need from him? I know I need the R to R, the QT. He'll give me the QTC, but I know in Epic, the flow sheet that I wrench in, it will calculate the QTC for me. I also need to make sure he wants me to start this initial dose, and then we can go from there. Hi, Dr. Mullet. Yes, thanks for returning my phone call. What lead are you looking at? Lead 2? Okay, great. I'm going to circle that on the EKG. And what is the R to R? 0.85 milliseconds? Okay. What about the QT? QT is, all right. I'm in my patient's Epic Buttercrunch, Mr. Ron Buttercrunch. I'm going to go to flow sheets, and over here I'm going to type in Tikosyn and just wrench it in. You can see I've already have it, it's already here displayed. First question was, did I do a 12-lead ECG before? The answer to that is yes. Dr. Mullet used lead 2 to diagnose the measurements, and I'm just putting in the measurements what he said. 0.85 for the R to R, 0.406 for the QT. QTC is automatically calculated, and he said it was 0.440, so that's correct. I've already checked my MAG and K to make sure they're within normal limits, and the baseline creatinine is within normal limits. Intervention, as far as this, I will probably write something like Dr. Mullet has read the EKG, and it's okay to start the initial dose.
At 0900, the nurse delivers the first dose of Tikosyn. At 1100, the EKG is performed.
It's a little bit after 11. I've got my 12-lead EKG after the 2-hour post first dose. I've scanned it into Epic, so I'm going to call the physician. I know exactly what I want to ask him when I call him, and I'm going to find out what we're going to do for the 2100 dose.
You should
I'm
report the
taking him
11
now.
o'clock EKG before 1400.
Hi, Dr. Mullet. This is Colleen. I'm calling about the 2-hour post EKG on the patient. Do you have a chance to read it right now? The R to R was 0.88. Great. What about the QT? 0.448. Okay. QTC is 0.478. Okay. And then it looks like the percent increase is 9%. Okay, and give the dose at 2100? Great. Okay, I will let the night nurse know that. And then we'll probably call you between 7 and 8 tomorrow morning to read the 2300 EKG, okay? All right, thank you. Bye.
At 2100, the nighttime dose of Tikosyn is given. At 2300, an EKG is performed and scanned into Epic. At 0700, the bedside report is performed. The physician should be notified of the 2300 EKG between 0700 and 0800 in order to know if you should administer the 0900 dose.
Good morning, Dr. Mullet. This is Colleen. I'm calling about Mr. Butter Crunch, and he's on Tikosyn, and I wanted to have you read the last night's EKG at 2300. R to R is 0.88. All right, I've got that entered, and the QT is 0.48. Okay, that means the QTC is about 512. That's what my measurements say when Epic does the math. Looks like the percentage increase for the QTC is 16%.
16%.
16%. Yeah, that's a little high too. So what would you like me to do for the 9 a.m. dose? Hold it? Okay, I'll hold it until you round. How's that sound? All right, thank you. Bye.
Hi there, guys. We have a few tips on Tikosyn and Sotalol. We've been hearing questions and concerns with the new order set, so we're hopefully going to address a few of those. First of all, you do want to notify the prescribing provider. Whoever has ordered for the Tikosyn is who you want to call for the follow-up for reading those ECGs. I know there's been questions on this, but whoever has ordered for the Tikosyn or Sotalol is who you want to call to read the ECGs. This just provides consistency for ECG reading. You may end up contacting the nurse practitioner, but they will probably defer back to the physician. Also, please do not call between the hours of 2300 and 0700. Give a good bedside report, and then the daytime nurse can call the physician in the morning. Also, if you're having a hard time reaching the physician, try to think outside the box, possibly taking a paper EKG and putting it in front of that physician.
And then we're going to talk about the Tikosyn and Sotalol flow sheet. Use it. Go into your vital signs, wrench in the Tikosyn or Sotalol flow sheet and use it. Very important for nurse-to-nurse report so the nurse following you knows exactly what the measurements are. Pharmacy also uses this flow sheet, as well as the nurse practitioners and the physician. So it's really important to fill out that flow sheet. Also, we wanted to mention that you still need to do your daily rhythm strip on every patient, just like you always do using the electronic calipers. This has nothing to do with your daily rhythm strip. We use the 12-lead EKGs with the Tikosyn measurements. And then lastly, if the physician or the nurse practitioner, advanced practice nurse have any questions, please refer them to Dr. Gupta. He is the point of contact, and he can educate them and answer any of their questions.
Thanks, you guys.
Thank you.
Let Colleen or Jamie know if you have any questions. Bye.